My name is Felicia Hunter, and I'm 45 years old, and I had the HeartLight procedure for my AFib. I was at work, like a day like this, finishing up, sitting at my desk, and I was writing a couple of notes. I just felt really strange. My heart started to beat really fast, and I didn't think nothing of it, just like, oh, well, I'll be okay. I got up and I went in the kitchen, but as I got up to go in the kitchen, I felt a little faint. I got up, but I didn't get up. 20 minutes later, I wake up on my way to the hospital.
Many patients that come to me with atrial fibrillation, they have more subtle symptoms or symptoms that have gone on for a while. But in this specific patient's case, she had an episode of passing out. She lost consciousness. She was extremely frightened. She had no clue what had happened to her, and she came in through the emergency room and was told of something that she had never heard of before.
And to actually find out that something was really wrong with my heart, I would have never thought that. And it's just weird that how long it went on. Having to educate myself on AFib, now I know and I see what the symptoms were, but I would have never thought that.
Atrial fibrillation has a huge impact on people's quality of life. If you, quote unquote, fix their atrial fibrillation, if you cure their atrial fibrillation, if you even reduce the amount of episodes they have or the duration of the episodes they have, patients feel a lot better. Felicia was one of the first patients that I was able to treat with the HeartLight X3 laser balloon, and her procedure went extremely well. It was very fast, and to date, she's had no recurrence of any arrhythmia. She's maintained normal rhythm. She's off of an antiarrhythmic medication, which is extremely important. To differentiate radiofrequency ablation versus a balloon ablation in general, the balloon affords the ability to go in a circle with the energy source around the opening of the pulmonary vein to cause a pulmonary vein isolation. The one thing I can say is that to isolate pulmonary veins, in my humble opinion, balloon technology wins out over radiofrequency technology. The difference between the laser balloon and the cryothermal balloon is the laser balloon is conforming. It can conform to the shape of the pulmonary vein, whereas when the cryothermal balloon is being frozen, it cannot. The shape is fixed. So some are slit-like, some are oval shaped, some are true circles, some are octagonal. So there are many different shapes, and having a balloon that actually conforms to the shape adds to the ease and effectiveness of the procedure.
I feel better, I really do. Now I ride my bike. I do a little bit more walking, and it's one day at a time. There is no swelling in my ankles. My feet doesn't hurt like it did before. The shortness of breath is not there. I still have stairs at home, but at least I can get to the top of my stairs and I can still breathe.
She has had a successful procedure, does not have to deal with atrial fibrillation, and has not had dizziness or passing out, and is not fearful of that. So she's able to conduct her life normally.
Thank you. There's nothing else I could really say. There's not even enough words to put, just thank you. And keep doing what you're doing and keep saving lives. You'll have a longer life. That's what I believe. You'll get to see your grandson, like me.
Today we'll be doing my 75th HeartLight X3 laser balloon ablation. The fact that HeartLight has reached the milestone of having done over 10,000 procedures worldwide is quite an accomplishment, and I look forward to being part of the next 10,000 patients to be treated with the HeartLight laser balloon.